Hi everyone, welcome to another webisode of The Good Doctor on EasyLiving.com. Today I'm here with Dr. Lobna al-Messery from the Proficiency Healthcare Diagnostic, and we're going to be talking about thalassemia. Stay tuned. So Dr. Lobna, the first question that I got to ask you, and I think our audience would want to know, is what is thalassemia and why should we be concerned with it?
Actually, thalassemia is one form of the inherited blood disorders which when acquired in its severest form, the patient has to be on regular blood transfusion all the time to maintain normal activity of life. And this regular blood transfusion actually leads to more complications on the long run, like iron overload, deposition of iron in different tissues, which lead to maybe the development of diabetes and as well as cardiac abnormalities and like that. So these people are really short-lived.
So just so I understand this, I have to be on a blood
regular
transfusion
yeah, like every 3 weeks.
Every 3 weeks?
Yeah, almost.
Throughout the course of my life?
Yeah.
That's pretty intense because pretty much people have to live in a hospital.
Yeah.
But what happens if I have thalassemia? What is it that I need to worry about?
You need to worry at least about your quality of life, your shape, because in its severest form also it leads to bone deformities. The people has specific features, like they call it mongoloid features. Mm-hmm. The cheekbones are really prominent and the nasal bridge becomes depressed. They have specific features. These people have stunted growth. They don't reach the normal average dimensions of the normal adult. All the time they look pale. They have jaundice, like red, yellowish discoloration here in the eyes. Plus the quality of life, they have easy fatigability. They cannot do the normal effort like regular people. They develop complications on the long run. They have enlargement in the liver and the spleen, and they have this huge abdominal distension because of this enlargement of the spleen.
So how do you go about detecting thalassemia?
Actually, I have to say first that to get the thalassemia in its severest form, which is called thalassemia major, both parents of the patient should be carriers of the abnormal gene or the defective gene. But
so this is a genetic
disease, inherited disease.
Okay.
But if you have only one defective gene, you are called thalassemia carrier or trait. This person is really lucky because they don't suffer from anything. Maybe they have very mild degree of anemia and can be accidentally discovered. They have a normal lifespan. Everything goes normal with these people. Thalassemia cannot be cured. The only curative treatment is stem cell transplantation, which is really expensive and really difficult to find a proper or a suitable donor. That's why they're now going for cord blood transplantation, collecting stem cells from the cord blood of the newborn, and they go for this kind of stem cell transplantation, which is really expensive and no one can afford, and not everyone can afford such a costly therapy. Sure. This is the only curative treatment, but for the rest, about what we said, this is only supportive care.
Right.
Just to maintain the patient living.
So if I understand this correctly, both mother and father need to have the gene.
The defective gene.
The defective gene, yeah. The abnormal gene.
Yeah.
And as a result, a child can be born...
There is 25% chance for a child to be affected. 50% chance to be carrier and 25% to be normal if both parents are carriers.
Okay. And you described the effects of thalassemia, yeah. The abnormalities and the defects. And the only thing what can be done with people who have thalassemia is basically care. Supportive care. What does this supportive care mean?
It means that it affects the quality of life of the parents as well. Mm-hmm. It's very costly. It's very difficult to have like a really ill child all the time, taking him to the hospital every 3 weeks at least. You have to spend like how many hours for taking blood transfusion, expecting any complication to happen at any time. So this is really difficult, the difficult quality of life for both parents and for the patient, of course.
And what is the hospital, what is the role of the hospital or the health center, could it be?
Monitoring of the patient and the development of the complications, supplying the supportive care, doing the blood tests on regular basis to check if the patient is really on having good hemoglobin level, he's really benefiting from the transfusion, to do a regular test to detect if there is a development of complication like iron overload or diabetes or whatever like that.
It's a complicated disease and it has multiple effects. It affects not only the person with thalassemia, but it also affects their family, their immediate family, and their surrounding.
Sure.
So this is something that is of concern. If you've got any questions about thalassemia, please leave them in the comment section down below, and Dr. Lobna will be happy to answer them. Thank you very much for being on this show. Thanks for watching The Good Doctor on EasyLiving.com, where you can find anything and everything lifestyle.